Hello, everyone. Welcome. This is Vicky Castillo with Facets Healthcare Training, and I'm an RN. And greetings from Phoenix, Arizona. Today, I am going to talk about a subject that I think is going to be beneficial for our future nurse aide students that are going to be testing because this is a high test month. I am again the founder and president of Facets Healthcare Training. Welcome to this Facebook Live. Thanks for joining us. To begin with, I'm going to put my contact information in the chat because I don't want to forget. The last time I forgot, so I want to make sure that I do that. Please feel free to reach out to me anytime, though it is a general email. I receive all the emails, and my team forwards the emails that I need to answer directly. So feel free to do that at any time. So thanks for joining me, and please put your comments in the comment box because I'd love to hear from your comments. All right. Okay, so the topic today is what to expect in the nurse aide certification exam. So what to expect, what the candidates can expect prior to, during, and after. So I am excited to share this topic with you all. All right. So first and foremost, I talked about it briefly last week. So the first thing is you need to be familiar with the nurse aide candidate handbook. First and foremost, have to be familiar with the nurse aide candidate handbook. So let me just go over what I reviewed in detail last week during my session last week, my Facebook Live session last week. So every state has a nurse aide candidate handbook, and in order to prepare and know what to expect on the certification test, you must have it available. So here's one for Wisconsin. It needs to be the latest version too. They are available on the test vendor's website, so make sure that you look and make sure that you have the last one. Here's one from Nevada. Here's one from Arizona. Here's one from Pearson VUE, and I don't have mine from Prometric, but Prometric has them as well. So every state has a candidate handbook that gives specific information as to what to expect for both the theory test of the certification and the skills component of the certification. So that's first and foremost, have to be familiar with that. I just also want to back up just a little bit and briefly talk about my background and my familiarity with the certification process. I was an RN evaluator with 2 CNA test vendors for quite some time. The first was Headmaster. I was a test evaluator with Headmaster for almost 10 years, and then I was also an RN evaluator for Pearson VUE for about a year. So I've been a test evaluator for 2 test vendors, so I feel that I have a pretty good understanding of the testing process from an evaluator standpoint. So I wanted to share my knowledge with you, and hopefully that will help with the students passing the certification test the first time. So again, having the candidate handbook and being familiar with it is very important because the test vendor provides all the needed information in there in those candidate handbooks. So right now I'm going to focus on the skills section of the handbook and not the theory, because the theory component, I'm going to talk about that next week. So the handbook tells you how to register for the test event, where to find testing sites, when to arrive at the test sites, usually about 30 minutes early, what ID is acceptable and permissible, and what is required ID. Not any ID will do. The test vendors are very specific as to what ID the student or the candidate needs to have in order to test. What supplies to bring, how much time they will have to test, what grade is necessary for each skill in order to pass the skills test, what skills are order specific and which are not order specific. What are critical steps or bolded steps on the skills, whether you can make corrections or when you can make corrections and how to make corrections are all in that candidate handbook. It also in the candidate handbook tells about what is the role of the actor or the model or the patient or the resident when doing the skills. So it tells that in the candidate handbook. The handbook also explains how the skills are randomly selected by the computer and the algorithm the computer uses to decide what skills a candidate would have. So the candidate is always going to have a combination of easy, medium, and hard skills. No candidate will only receive easy skills. No candidate will ever receive all medium skills, or no candidate will receive all hard skills. Because oftentimes students ask that question. What if the computer chooses all hard skills for me? Well, that is not going to happen. Or that would be nice if the computer chose all easy skills for me. That's not going to happen either. Every test vendor has a specific algorithm that the computer follows in order for each student, so that each student gets a well-balanced and equitable skills test. So that's how that works. And then most importantly, the candidate handbook talks about what skills the students will be tested on. So some test vendors have 19 skills. Some test vendors have 23. Some of them have more than that. So every test vendor is different, but the students need to be familiar with doing every single skill that they could potentially be tested on. So they need to be familiar and proficient with each one of those skills. Okay. All right. So let's talk about a couple of other things I want to bring out. The students need to arrive, or the candidates, one and the same, need to arrive on time, typically 30 minutes early. Early is very important. Some test vendors will not allow the candidates to test either the written or the, which I call the theory component, or the skills test if they arrive late. So it's very important that they arrive early. Generally speaking, like I said, it's 30 minutes early. Also, they need to remember to bring their proper and acceptable ID. I can say with certainty that if they do not bring the acceptable and proper ID, they will not be allowed to test, and they usually lose their testing fees. And whether that was paid by the school or whether that was paid by them privately, they will usually lose their testing fees. So it's very important that they bring the proper ID. They will need to show their ID both prior to taking the theory component of the test and the skills component of the test. So they need to have it on them the whole time. They could have a considerable wait at the test site because just typically one student is administered the skills test at a time. Sometimes students can wait up to 4 to 6 hours for their turn to take the skills test. So it's important that they bring study material, healthy snacks, and fluids. They don't want to go into testing hypoglycemic with a headache or shaking from low blood glucose. I've seen that before. So it's very important that they know that they're probably going to have a considerable wait for their turn to do the skills test. And that's usually where it takes the bottleneck is in the skills test. The theory test, it's usually administer them to the students as a group in a room, but the skills test, not. It's usually one at a time. So there is a bottleneck there, and it takes time to process those students one at a time. They also need to visit the bathroom before going into the testing room. I don't want to go into detail about that, but I think it's pretty self-explanatory. Okay? All right. I want to take a minute also to talk about which skill is the most difficult, because I'm often asked from the students, because I also teach CNA still. I'm often asked by the student, Ms. Castillo, what is the hardest skill that I should prepare for? What is going to be the one that I should practice the most? And my answer is your anxiety. Managing your anxiety is going to be the most challenging skill that you're going to have. Because when going into testing, it's a very anxious and nerve-causing event. Remember, an RN evaluator is closely watching every move that the candidate makes, and it can be nerve-wracking. It is nerve-wracking. Us nurses, we don't have to go through a skills test, but I'm sure if we did, it would be very nerve-wracking for us too. During my times as a tester, almost every student was trembling when they came into the testing room. When I called them from the waiting area to the testing room, they were always trembling. Many cried. Some go into hyperventilation. Some throw up. Some pass out. I've had that happen as well. So it's a very stress-inducing process. So it's important to recognize that and prepare the students for that. If you're an instructor that's preparing your students for testing, prepare them for that. Give them some relaxation techniques. Talk about that they're going to be anxious, and prepare them for, and give them tips on how to manage that anxiety. Okay, and everybody responds to stressful situations differently. But how do you prepare for your anxiety-filled events? So talk to them about that. Well, knowing it's going to happen, number one, knowing that you're going to be anxious is important. I'm going to be anxious, so I knew this already, so I'm expecting it. Follow the recommendations on my Facebook videos about how to prepare for the test. Being prepared helps manage anxiety. And then lastly is practice, practice, and practice the skills before coming to testing. So the students are confident and they know what they're supposed to do. They know their stuff, because it's very obvious when students have practice. When I test them, when I've been a test evaluator, it's very obvious when students have practice, because they're initially very anxious, but once they get rolling on the skills test and they start doing and they see they're getting into a rhythm, their anxiety lessens considerably. And that's because they have practice ad nauseum, and that's really what helps reduce anxiety. So how much the students be practicing for the skills test? I generally recommend 14 to 16 hours before they come into testing. And again, they need to practice each skill before testing at least once, but preferably twice. And I find that's anywhere from 14 to 16 hours. So if a school has open lab sessions, then the students should be there to practice. Or if you're a candidate and the school doesn't have open lab sessions, ask the school, when is the lab available, because I want to come into practice. And when you do come into practice for your skills, don't come in alone. Preferably bring a classmate, because you can bounce ideas off of each other. Did my teacher say to do it this way, or how did the video say to do it, or do you remember? So you bounce ideas off of each other. Using the mannequin in the lab is not a good substitute for a real person, because remember, most of your skills you're going to do on a real person, a model, an actor, or your classmate, but so the mannequin is not a good substitute for that. So be sure to bring a classmate, and if all else fails, bring a friend, but preferably don't come alone. And then the other thing that helps manage anxiety too is don't do negative self-talk. Stop telling yourself, oh, I just know I'm going to mess up. I just know I'm going to fail the test. Instead, tell yourself, I know I can pass this test. I prepared for it. I can do it. I'm going to do it. I'm determined to do it. I practice and practice and practice. I prepared. I'm going to do it. I can do this. I know that I can do it. So practice positive self-talk. That's very, very important. Okay? All right. Next is so we talked about preparing for the skills test. Now we're going to talk about the actual day of testing. So when the RN evaluator calls the candidate's name in the waiting area, the evaluator escorts the candidate into the room and will ask to see their ID. Okay, so the candidate has to show their ID. Then the evaluator will have them sign the recording form. Every facility, every test event and test vendor has a recording form, and that recording form is where the candidate is going to record vital signs, blood pressure, respirations, pulse, fluid intake, food intake, urine output. And again, this is general information. Your state, you may not have urine output, but if it does, that's where it's going to be recorded. So anything that needs to be documented needs to go on that recording form. Okay, so and that recording form needs to stay in the room the whole time. In other words, the student cannot take it with them when they leave the room. It's a verification of recording, and also for the test vendor, or if there's ever any dispute from the student. So that recording sheet never leaves the room. It stays with the evaluator. Okay. Next, the evaluator will tell the candidate the amount of time they will have to complete their skills. And then at that point also they'll tell them what their skills are. This is where the big revelation occurs. This is where the students will be told what their skills are. Then the RN evaluator will walk the student around the skill room and show them where all their supplies and equipment are for their skill. They will show them also some additional information besides supplies and equipment for their skills. They'll show them the bed controller, how the bed raises up, lowers, head of the bed up, head of the bed down. They will show them where the call light is, how to lock or unlock the bed brakes. If they're side rails, I know many of you don't use side rails, so that's okay, but some states do still use side rails for testing, believe it or not. And they'll show them how to lower and raise the side rails. They'll show them where the sink is, where the soap is, where the paper towel is, where the bathroom is. So they will walk them around the room and show them and orient them to the room. Even if the student is testing where they trained, the evaluators are almost always obligated, with few exceptions, they're obligated to show them around the room and familiarize them where their supplies and equipment are. So it doesn't matter whether they have trained at that facility or not, they still have an obligation to show the student where the supplies and equipment are. And it's also a good opportunity. I always, as an evaluator, found that as a good opportunity to kind of break the ice with the student, have them get a feel for me that I wasn't an ogre there to fail them, So they started to calm down. They're like, hey, she's not so bad after all. Hey, I remember. Okay, now I know where this is. So again, getting knowledge is powerful to reduce the student's anxiety. Okay, and I just want to remind that if the student is not going to have a specific skill, then they're not going to show them equipment for that skill. For example, if they're not going to get blood pressure, then the evaluator is not going to show them where the blood pressure cuff is. There's no point. Why fill their heads up with unnecessary information, which only increases their anxiety? Okay? At that point, the evaluator will proceed to give them any additional general instructions before starting the first skill or starting the timer. This is the point at which the candidate should ask questions about any supplies, equipment, or testing, because generally speaking, once the timer starts, the evaluator will not answer questions. So this is a good time to ask questions about, oh, I didn't see washcloths, but I needed washcloths. Well, here they are. Or I don't think that's going to be enough washcloths. I only see 2 there, but I'm actually going to need 6 of them. So this is a good time during the room orientation time to make sure the student speaks up and make sure that they have the supplies and equipment that they need, and they know where to locate, and they know how to work equipment and the equipment that's necessary to do their skills. How far do I pull the privacy curtain? That's the other one I often would hear. How far do I pull the privacy curtain? So I would tell them how far. How do I lock the bed brakes? So anything that they need, this is their time. They paid for that time. This is their time to ask questions. Okay, the RN evaluator will tell the candidate the order in which they need to do the skills. The candidate does not get to decide in what order they get to do the skills. It's the evaluator that decides in what order to do the skills. Okay? All right, and so as the student completes one skill, then the evaluator says, okay, if you're ready for your next skill, the next skill is. So when they are done with that one, then they'll say your next skill now is. So oftentimes the students get very stressed about not knowing how or trying to remember in what order to do the skills. It's not for them to decide. The evaluator will tell them in what order to do the skills and when to do them. Okay, when it's time to do the next one. Once the timer starts and the candidate starts to do the first skill, the RN evaluator typically does not answer any questions unless they're very simple and questions and that they apply to supplies. For example, the evaluator forgot to show them where the bedpan is and they needed that. Simple things, but as far as questions outside of that, the evaluator doesn't answer those questions. Okay, so just as a side comment also, the candidate may ask the RN evaluator to repeat instructions pertaining to a skill or a scenario as many times as needed. For example, if this student doesn't recall that the evaluator told them what side is weak, they can ask again, can you tell me what side is weak for addressing the dependent patient? They can tell them that. Or Can you tell me again, am I supposed to reposition the patient on the right side or the left side? So remember, the evaluators know that the students are very nervous, so they may not hear the instructions the first time. So yes, they can ask them that information about scenarios and instructions. So that is perfectly acceptable for them to ask them questions about. I'm sorry, I forgot. Can you tell me what side is weak, or what side am I supposed to, do the blood pressure on? So they will answer simple questions like that. Many states allow correction to skills, but be absolutely sure that you understand how and at what point corrections can be made. That's very important. This varies from state to state. Typically, though, you must verbalize what skill you want to make a correction on, and then must demonstrate the correction. You cannot only verbalize a correction, you have to demonstrate a correction. So if a candidate can make a correction on a skill step, they need to tell the evaluator what correction they want to make, and then do the correction, not just verbalize the correction. If they want to verbalize in addition to demonstrating, that's okay too, but they cannot just say, oh, I would have pulled the privacy curtain, and not pull it. They have to actually do the correction, okay? It is totally acceptable to verbalize skills as you do them. That's perfectly okay. Many students do, because it helps them to process and stay on task. So it's totally acceptable, and most students do verbalize as they do skills. But you cannot just verbalize and not do the skills. I've had that happen before, where a candidate just stood there at the edge of the bed and just verbalized doing the entire skills task, but never touched the patient or the actor. So of course that student failed, but that's not typical. But just an FYI, yes, students can verbalize as they're doing skills, but they cannot only verbalize and not do skills. They have to actually do them. Some students choose not to verbalize. They're sometimes very quiet, but just be clear on what steps do need to be verbalized. Some states do require students to verbalize certain content, certain steps, so just be familiar what does need to be verbalized and demonstrated, okay? As far as recording, remember, if it wasn't recorded, it wasn't done. So if a candidate fails to record, it usually causes them to fail. And I'm pretty certain about that. So if it wasn't recorded, then it usually is a failed skill, okay? RN evaluators will not tell a candidate if they are within range for any recorded steps or any skill until the end of the entire skills test. So for example, taking a radial pulse, the RN evaluator will not tell the candidate whether they are within range or not within range. That's a decision that the candidate needs to decide, whether they think they're accurate or not, or if they want to redo that skill if they're at a point where they can. So it's the candidate whether they need to determine whether they are certain on their recording or not, or if they want to redo that. Let's see here. So as far as timing is concerned, it varies the amount of time students get for doing their skills, but generally speaking, my experience has been for a well-prepared, well-practiced, well-rehearsed student, the amount of time that they receive for doing their skills test is ample amount of time. They should have time extra. Again, the key words that I used was well-prepared, well-rehearsed, and well-practiced student. If a student is not well-practiced in their skills, they're probably no amount of time is going to help them pass the skills test. So that's been my experience, is that the amount of time that the students get to do their skills test is plenty if they're well prepared, okay? All right, results are available sometimes that same day for some states, and sometimes they have to wait a couple of days to get the results back from the test vendor. It depends, all right? And then the RN evaluator. The RN evaluator is not there to fail them. I hear that all the time. Are they going to be mean? Are they going to try to fail us? No, they are cheering for you. We want the students to pass, but they also have to demonstrate competency, and they also have to pass the skills test according to the rules and regulations of the test vendor. That's the bottom line. But that the RN evaluators are out there wanting to fail candidates, that is not the case at all. So just that's important to know that that's not the case. Okay. As far as what fails students on these skills tests, I want to go over that a little bit, is not being familiar with the steps of the skills. Not knowing what the bolded items are or if there's any key steps, not being familiar with those or not doing them. Being out of range for vital signs is another big one. The most, I would tell you that nationally, probably one of the most failed skills nationally is manual blood pressure. Students are often out of range for manual blood pressure, and that seems to be a national trend. And there's many reasons for not being within range of manual blood pressure. That would be improper placement of the blood pressure cuff, not putting the stethoscope in the right location. They don't know where the brachial artery is. Another one is on the manual blood pressure, they put the earpieces backwards. Another one is they don't hear the systolic or diastolic, and they just write any number. They just guess. That's another one as well. So there are many reasons. Technique is one of the biggest ones. So for failing the manual blood pressure. So I see that not being within range. And then I don't often see it, but timing out. And sometimes students, well, not sometimes, but students time out because they have done too many corrections. And why have they done too many corrections? Because they weren't well practiced. They weren't familiar enough with the skills test. So they just didn't know the steps well enough. So they had to go back and do correction after correction after correction, which eventually led them to fail. What are some other reasons for failing the skills test? I would say those are the main ones. After the student passes, the candidate passes, let's talk about passes the certification test. There is a collaboration or there is a discussion or a process, I guess I want to say, a process between the test vendor and the registry, the state registry, for submitting results to the registry, and then getting the name on the registry, and then the registry will give the candidate a CNA number, and the student is officially a CNA. So that is some information for getting on the registry and what to expect on the skills test. I think I have covered pretty much everything, and if you have any questions about the testing process, please feel free to reach out to me. I'm happy to answer any of your questions, and I hope these tips have been helpful in passing the skills test. You all have a great rest of your day, and happy Mother's Day for those of you that are celebrating Mother's Day. And saying goodbye, you have a good rest of your day. Thank you.